Hello. Good afternoon, everyone, and welcome to today's webinar, which is held to mark World Urticaria Day. Chronic urticaria remains a complex condition, with many patients experiencing a late diagnosis, limited treatment access, and many ongoing impacts on their quality of life. My name is Laura, and I'll be facilitating the session today. We have a very large audience tuning in, for which we're very grateful. But again, this highlights the importance of urticaria, and we hope to be able to address the public's need to know more about this skin condition as well as its treatment options. So without further ado, we will kickstart the webinar with our very first talk from Dr. Dawn Oh, who is an associate consultant at our dermatology department at SGH. She will go through with us on what urticaria is, the various types of urticaria, the underlying mechanisms, as well as their clinical features. So I shall hand over my time to Dr. Dawn, please. Thank you.
Hello, everyone. Good afternoon. Thank you for joining us today as we celebrate World Urticaria Day. Today, we'll be talking about what urticaria is, its types, clinical features, and mechanism. My name is Dawn, and I will bring through you several types of conditions. So stay with us. So, what is urticaria? What does urticaria look like, and what causes urticaria? So the medical term for urticaria, urticaria is a medical term, but colloquially and locally, my patients refer urticaria as hives, or in Mandarin we call it 荨麻疹 urticaria, or 痘阿里布. And hives are actually raised or puffy areas of the skin that itch intensely. So urticaria can appear as localized itchy rashes that consist of little swollen patches of varying sizes. Sometimes it can appear as small bumps like this, and it resembles mosquito bites. Or it can appear as wheals or larger patches, and these can be circular or sometimes can appear in different shapes and sizes. And in many cases, the raised edges can enlarge and merge together to a bigger patch. And urticaria can really affect any part of the body. Each wheal resolves in 24 hours. However, new wheals may continue to erupt in other areas. In patients with darker skin type, the color changes may be more subtle, but you can still see the raised and swollen wheals over there, and these can be intensely itchy. So the rash typically lasts for a few hours. So initially, it may appear as red swollen patches, and it can be very obvious and exaggerated in this case. But as time passes, you notice that the swelling actually becomes lesser, and within 24 hours, it should disappear and show normal skin below. Hives, as mentioned earlier, can affect all parts of the body, including the face, and other areas such as the ears, the neck, trunk, and limbs. Sometimes it can involve deeper tissues around the eyes or the lips, and it can cause swelling. And this condition is called angioedema. So the impact of urticaria is actually tremendous, and hives are a very common condition. 1 in 5 patients worldwide report having urticaria at one point in their life. And actually, there was a study done in Singapore, and it actually reports that up to 43% of Singaporeans are affected by this condition. And the top burden reported by Singaporeans were itch, sleep, feeling very tired, and interference with their daily activity. So a lot of my patients ask me, so Dr. O, what causes urticaria? And in simple terms, hives or urticaria develop when there's a reaction that activates immune cells in the skin called mast cells. And when mast cells are activated, these cells release chemicals called histamines. And this histamine itself causes itching, redness, and swelling of the skin, and what we see on patients called hives. So as mentioned earlier, hives appear suddenly and can disappear within a few hours. So we have mentioned about urticaria and hives, but seriously, there are many different types of urticaria that usually, as doctors, we try to elucidate and try to discuss with our patients. So broadly speaking, hives are classified upon how long you have the hives. Hives can be acute or brief. They can be chronic or long-standing, or they can be inducible. When we say inducible, these are triggered by certain types of physical stimulation, such as heat, cold, or sun exposure, etc. And when you first get hives, you cannot tell how long they will last, right? So at the initial part, you cannot tell if you have acute or chronic hives. So a lot of my patients then ask me, so doctor, how do you know when I come to see you? So we form a close partnership and consultation with our patients and family, and most of the diagnoses can actually be clinched with just history taking and physical examination. So therein lies the importance of consulting your doctor early, because an earlier diagnosis can sometimes result in earlier management and trigger avoidance and better outcomes for you. So as mentioned earlier, the difference between acute or chronic hives is in its duration. So acute urticaria lasts less than 6 weeks. Most of the time, we cannot pinpoint to a specific trigger, but sometimes my patients do report recent infection, insect bite, new drugs or food. Whereas chronic urticaria tends to be more long-lasting. It persists for more than 6 weeks, and it can be categorized into spontaneous or inducible forms. So we'll now move on to acute urticaria. So viral infections actually cause more than 80% of acute hives in children. And a variety of viruses can cause hives, sometimes even routine cold viruses. And these hives seem to appear as the immune system begins to clear the infection. And these hives typically persist for 1 to 2 weeks, and then they will disappear on its own. What about drugs? A lot of my patients are very worried that they have a drug allergy. And indeed, many types of drugs can trigger hives. And these are just some of the common medications. But really, a consultation with a doctor is needed to determine the cause. In children, insect stings such as bees, wasps, hornets, and fire ants can cause hives around the sting area as seen here. However, if you do get hives all over your body after an insect sting, this may be a sign of a more serious infection or reaction called anaphylaxis. And anaphylaxis is a medical emergency and should be treated as soon as possible. Next thing, my patients always ask me, oh, doctor, do I have a new food allergy? So indeed, food allergy can cause acute hives, but food-associated hives typically appear quite quickly within 30 minutes of eating the food. And what I tell my patients is that it has to be consistently reproducible. So in children, food allergy tends to be slightly more common, such as milk allergy, egg allergy, etc. And whereas in adult, food allergies are actually much less common. Lastly, physical contact urticaria or contact allergy can be seen in some of my patients. And this can occur after you touch certain substances if you are allergic to them. So for example, children who are allergic to dogs may get hives if a dog licks them. And other things that can cause hives if you're allergic to them includes plants, raw fruits, vegetables, and rubber products, commonly found in balloons, latex gloves, etc. So hives can occur as a part of a more serious allergic reaction, and you should see a doctor as soon as possible if you develop hives or angioedema suddenly, along with other symptoms, such as trouble breathing, tightness in the throat, nausea, vomiting, cramping abdominal pain, or even fainting. So we've gone through several types of acute urticaria. Now we'll move on to chronic urticaria. So I'll illustrate what the burden of chronic urticaria is through a case presentation. So Mr. Jonathan is an 18-year-old male, and he's in consultation with his mom in our dermatology clinic. And he asked, Doctor, I have severe hives that's affecting me. I can't eat or sleep due to the itch. What is happening to me? And then he further reports that this rash has started 4 months ago on my arm and is now spreading to my body and my legs. Thankfully, my face is spared so far. And then the doctor says, this must be really troubling, and I'm sorry to hear this. The doctor would ask, how is it affecting you on a daily basis? Can you work or sleep well? Are there any triggers that make your hives worse? Then the patient replied, yes, I have missed many days of work as I'm afraid of being seen scratching continuously or being a contagious patient. I think sometimes wearing tight trousers may make the hives worse around my waistline. patient's mom then asked, Doctor, is my son allergic to the new laksa mix that I used this morning? Is this a food allergy? And Jonathan added then, other than the itchy hives, I've been well physically otherwise. The doctor says, I think you have chronic urticaria. Let me perform a thorough physical examination and some tests to confirm the diagnosis. And indeed, this is what we see on a daily basis in our clinic. So chronic urticaria is a very common problem whereby chronic hives can occur almost daily to all our patients. And this can last quite long, 6 weeks, or sometimes even months or years. And chronic hives are frustrating because they come and go, and they can interfere with sleep, work, or school. Hives can also affect how you look, and people may worry being near you because they are very, very afraid that you have a contagious infection. However, it is very important to remember that hives are not contagious, and hives are rarely permanent. In fact, almost 50% of people are hive-free within a year. And chronic hives are actually really rarely caused by allergies, and they are not life-threatening. Symptoms of chronic hives are treatable in most people. And in most cases of chronic hives, the cause is unknown, but researchers suspect that there may be problems in the immune system that may play a role. So now we'll talk about chronic inducible urticaria. So another type of urticaria that form in response to some sort of physical stimulation. So the examples of physical stimulation include exercise, heat, cold, pressure, etc. And they're also called physical hives. So the commonest of this is called dermographism, whereby scraping or stroking can cause raised lines on their skin, or sometimes your skin may get a hive pattern that matches your fingernails after you scratch and itch. So this is one of my patients with severe chronic inducible urticaria or dermographism because she keeps scratching her skin and then she get the hive pattern that corresponds to her scratch marks, as you can see over here. Other rarer forms of chronic inducible urticaria include cold urticaria. So it's a chronic skin condition that occurs after sudden exposure to anything cold. Itchy red skin rashes typically occurs within minutes upon exposure to cold, and the reaction tends to be worse after the skin warms up when it's removed from the cold, or changes in body temperature or sweating. These hives typically look like small, tiny bumps, and they may appear on the trunk and the back. What about delayed pressure urticaria? So this is a special type of chronic inducible urticaria where hives on the palms and soles can occur after hours of carrying heavy objects or walking long distances. And because the skin on the palms and soles are thick, these areas may appear reddened and swollen without clear hives. Sometimes urticaria can also develop where pressure has been applied to the skin. So for example, gripping heavy tools, etc. And the swelling develops several hours later, and these hives can actually be painful and last longer than a day. Some other rarer conditions include vibration-induced chronic urticaria, whereby the palms may become red and swollen and itchy after holding on to a handle of a lawnmower or pneumatic drill. So a lot of my patients ask me, so doctor, after you see me in clinic, you have taken a history from me, you have examined me, do I need testing? I'm very concerned. So tests for urticaria are actually not needed mostly because the diagnosis, as mentioned earlier, is usually based on your symptoms and the physical examination. Specific skin testing for food and drug sensitivities may be recommended if your doctor has concerns about allergies as a cause of your symptoms. And this is usually done for persons with acute hives, meaning hives less than 6 weeks. Chronic hives are really rarely caused by an allergy. Blood tests may be done if there are signs of underlying diseases such as thyroid problems or autoimmune diseases in patients with chronic hives. So that being said, it's really very difficult to tell. And if you're concerned, I would suggest you to come for physical examination and history-taking consultation with us in our dermatology clinic. So in summary, urticaria is a common but distressing skin condition. Most cases resolve spontaneously, but chronic urticaria may persist for weeks or months. And understanding the types and mechanism is crucial for its management because if we do find the outward cause, of your urticaria, we can start trigger avoidance earlier and start you on medication, and that would really improve your quality of life. And with that, I thank you for your kind attention. I'll now hand over the time to Dr. Chai, who will go through with you the management tips for chronic urticaria. Thank you so much.
Moving on, I'm very honored to introduce Dr. Chai Ziteng. She's our consultant at SGH Dermatology, and Dr. Chai will be going through with us in more detail on how we manage urticaria, the current treatment options, as well as introducing the new and emerging treatments available. Thank you, Dr. Chai.
Thank you. Thank you all for joining us this afternoon. I'll talk about how we treat chronic urticaria. Okay. So I think there are a few parts, not just giving medication, but I think there are a few parts when we consider treatment for chronic urticaria. So you've heard about what Dr. Dawn said, Dr. O said. Trigger, usually in the case of inducible urticaria, so avoiding trigger is one important aspect of the treatment. Number two, if still with avoiding the trigger, it still happens also in the spontaneous type where it just happened without trigger, then medication is necessary. And the third component is, I think, a lot of us will be wondering, whether there are more than just medication. Is there anything else in the realm of complementary medicine or diet that can actually help change the disease? So in terms of trigger, in cases of inducible, very commonly pressure is important to avoid pressure. If your hives, you feel it usually is triggered by when it's too hot, when you sweat, try to stay cool. And really depends on what triggers your hives, and try to reduce and avoid that trigger if possible. Number two, if you have hives happening or you have itch happening, don't scratch. I mean, it's easier said than done. But we know that with scratching, it puts more pressure on the skin, and this will cause more hives to happen. So instead of scratching, what you can do is you pat or tap on the skin affected instead. Number three, dry skin. This might or might not be related. You might or might not have it, but this is really something that's easily preventable because dry skin very commonly causes itch without any rashes or eczema happening. With just dry skin alone, you feel itchy, you scratch, you have hives, you just get worse. So start with something simple. Incorporate regular moisturizer and use a gentle cleanser in your daily regime. And this is also related to pressure. And also, usually patients with urticaria or hives, they typically feel more than other people. For example, you might have been wearing like a shirt with wool, like really fine fibers, and that itself might trigger you to feel itchy when it might not happen in other people with no urticaria. So wear something that makes you comfortable. Wear lightweight clothing, prevent and avoid pressure, and this can help prevent further skin irritation and allow your skin to breathe better. So coming to treatment, what do we commonly give? First line treatment will usually be antihistamines, and typically we prefer those that won't make you sleepy, what we call non-sedating. And these four listed here are the examples that is non-sedating, right? Sometimes you might be given or you prefer to have sleepy one to help you sleep. And these are generally the older antihistamines. For example, you might have heard of chlorpheniramine or the branding Piriton. The other one is like a small white color one, hydroxyzine or the branding Atarax. I mean, they work well too, but it's just that they tend to have more side effect. They help you sleep. Other than that, it might also cause you to have dry mouth, sometimes dry eyes. And in elderly patients, especially males, it might also cause difficulty urinating. How much do we give? It really depends on how active your hive and condition is. You can either start with one tablet, and the maximum that we advise would be up to 4 tablets a day, and that's really is the maximum dose. When it comes to 4 tablets, it will be 2 tablets 2 times a day. And how do we then decide when to stop. The duration, they generally varies from person to person because everyone's response to antihistamines is different. But how do we monitor is that you gradually cut down. For example, you give enough time, like a month, slowly cut down. If you see your skin is still well, no hives flare, then you gradually cut it down until you're able to stop the medication completely. And really, when do we stop and how can you tell when to stop or cut down, right? Is when your condition is really well controlled. The aim here in treatment is really so that you won't have any wills or itch, most importantly. If you're not controlled with antihistamines, despite being on the maximum dose of 4 tablets a day, there are other medications that generally is used, and these are the newer medication called biologic. And in the case of urticaria, it's a specific medicine called omalizumab or the brand name Xolair. So Xolair is given once a month. It's injected under your skin. Who injects it? It can be yourself if you learn from the nurses. Or in cases where you can't do it yourself, then sometimes we can consider having injection done at our center. It's the first biologic approved by FDA for treatment of chronic hives, and generally people who are 12 years and above can receive this medication. Again, for this medication, how long? We will say at least 6 months, and then we see how you respond to it, whether we can stop the medication or slowly cut down. And how does Xolair really work? This might look a little intimidating with all the terms and all, but basically our body, in a person with chronic urticaria, have this antibody or protein called IgE in the body. This IgE, when it's not treated, this IgE will bind to a cell called mast cell, and this will cause the mast cell to burst and release histamine that cause itch and hives. So what this medication Xolair does is it binds to this protein called IgE so that the IgE protein cannot bind to the mast cell, cannot attack it, and hence the histamine won't be released and cause your hives. Other than omalizumab, in a very small percentage of patients, despite having this injection with antihistamines, is still not well controlled. And in those cases, we might consider more other medications. One that suppress the immune system, called cyclosporin. So if you might have come across or asked whether oral steroids can be given, generally we do not advise long-term usage, and even for brief acute flare, we try to avoid it if possible. But if the flare is causing a lot of distress, in some patients they might feel a bit difficulty breathing, but in truth there's no severe allergy reaction. In those very severe cases, with need for acute control, then this might be considered as a quick rescue option. So then comes the role of complementary medicine. I think AI, ChatGPT, and all probably does help us a lot in our daily basis. We do look at information, and also I just briefly look through Google, right? Whenever you Google, you'll find this AI overview that comes up with all the information, really quite extensive information, I would say. So I'll go through what are the recommendations, and so that you know what might work and what not. Okay. So the first thing that comes up would be topical soothers. For example, like oatmeal baths, aloe vera, baking soda paste. Would we recommend that? I would say for baths, in general, we tend to advise, or I tend to advise, to avoid excessive bath or shower because that may dry the skin. And dry the skin, it may cause you itch. So I think if you just use a gentle cleanser, you do your bath 1 to 2 times a day, clear your skin, I think that's sufficient. In terms of aloe vera, I think you need to be cautious with that because a lot of times it's there's a lot of added, like for example, fragrance, and typically, if you do want to soothe your skin, I would say a cream-based product is preferred over lotion or gel because we really want more of the oil cream texture to moisturize our skin. Whereas generally lotion, gel, they contain more water and they're not as moisturizing. What about baking soda paste? I would advise against it. If you overdo it, perhaps the alkaline actually can disrupt your skin pH balance, and that might cause problem, especially in the patient who has eczema or risk of eczema. There are actually products that we can recommend for you to soothe the itch. So these are the products available outside that contains menthol combined with moisturizer that won't dry your skin and probably might help you with the itch temporarily, that you can find in any Guardian Wilson or in Sing Health or SGH Pharmacare. Second is complementary medicine wise, it will be herbal and supplement therapies, which with various, probably nature plant derived ingredients. In general, natural remedies are not regulated or approved by the Food and Drug Administration, and I would say really use this with caution. Things that's, for example, plant products and all, it doesn't mean that they're safe, because there are natural products that can actually be harmful to the skin or even to the body. Traditional Chinese medicine wise, acupuncture, there are some studies on whether acupuncture might help with urticaria, but overall, I would say the studies, they are quite small sample size, meaning very little patients in the study, and hence the evidence is not that strong. And of course, diet-wise, I think that's probably a huge question, whether our diet can affect make hives worse, right? So do you need to modify your diet? This is rather controversial. I think usually when it comes to hive, there are two diet that thought to cause hives worse, right? The first group is this pseudo-allergens. What are really pseudo-allergens? They are the preservatives, dyes, or salicylates, and they can also be this compound called aromatic compound. It can be derived naturally. It can be found in food like garlic, artichoke, tomatoes, even fruit, or it can be found in processed food as well, for example, processed meats. But overall studies actually do not confirm that, if you stop eating all this food, it can definitely improve your hives. The second group is high histamine diet. If you look at this list, high histamine diet is really quite an extensive, long list. It includes mostly processed meat, but if you look at seafood, even certain oily fish, frozen seafood, dairy, a lot of vegetable, fruit, and some grains, they're also included in this high histamine food. Again, there's no strong evidence that if you avoid the high histamine food, your hives will be definitely well controlled. And what's more worrying is that if you look at this list, it's a huge list. If you want to avoid all this food, I think the more concerning part would be the risk of nutritional deficiency. So the other part of complementary medicine is also whether you can do mindfulness, meditation, therapy, and all. So we know that stress can actually cause hives to flare. All right. So mind-body techniques suggested, if you look in the AIOV, would be they recommend you can do some relaxation techniques, meditation, make sure you have proper sleep, establish a good sleep routine. While all this not studied or proven that it can improve your hives for sure, but because we know stress can actually worsen or trigger hives flare, indirectly, I mean, if these ways, this practice, if it helps you reduce stress level, helps you calm down, I think there's no harm in doing this to keep your stress level at bay and hopefully help prevent hives flare, although not purely to treat the hives. And how do we monitor to know whether your hives are better? Because if you have it every day, you have itch every day, it's easy to lose track of what days are bad, what days are good. So this is one of the scoring that we usually ask patients to fill up. It's called UAS 7. So what you do is, if you see the top here, Wheals or hive score. It will be based on how many wheals you have for that day. Then you circle it. And the itch score, how bad the itch is. Is it mild? Is it moderate, quite troublesome? Or is it very bad itch, intense, that really affect with your normal activity and sleep? Then you circle the scoring, or just write down the number, right? And you look across, you write the dates. You can even create your own table, actually, like based on dates. What's the wheel score? What's the itch score? And add up to a total. And your total weekly would be maximum 42. And depending on which number it falls on, will then determine whether your hives is well controlled, under control, or can be improved. If you prefer to use an app, there's this cruise control app that you can key in on your hives daily monitoring or activity. So I've come to my last slide, and I just really want to go through again what are the take-home messages. I think hives and itch, it affects our quality of life a lot. It affects our sleep, and it's really a vicious cycle. If you have hives, you scratch in the middle of the night, you can't sleep. When you can't sleep, the next day you wake up tired. You can't do your work or go to school or do anything well. That leads to probably more stress, and stress happens. Your sleep gets poorer and the hives gets more, and this really will just go on. And our aim here is to really help you stop this process. And when we want to treat, what are our goals? Again, I would like to emphasize that identify the trigger, because everyone's trigger is different. We'll need you to let us know what the trigger might be, and we'll advise you accordingly how to advise. When we treat, we really want to treat until you're symptom-free so that you can lead a normal life, and we really want to improve your quality of life. Yeah, so that would be my last slide. Thank you.
Thank you, Dr. Chai, for your very insightful talk, and I hope everyone has learned a bit more about how to manage urticaria. We will later go through and answer more of your questions in detail, but we are now at the very last part of our talk, and I'm very grateful to have with us three of our very own patients with urticaria. We're here to hear firsthand what it is like to live with chronic urticaria, a condition that often impacts our daily life far beyond just the physical symptoms. So these three patients have been living with chronic urticaria for the past few years, and today they'll be sharing their journey with us. So I'm delighted to invite with us as well Dr. Karen Chu. She's our senior consultant who heads the Urticaria Clinic at SGH. She'll be chairing this session. So without further ado, let's invite them to join us as well.
Good afternoon, everyone. I'm Karen, and I've been running the Urticaria Clinic at SGH for the past few years. And with me, I have three of our patients who have very kindly agreed to share their experience with us. Some of these patients, their disease are a little bit more severe, and we've been walking together side by side throughout their journey with urticaria. So we've interviewed them separately, and Dr. Laura has kindly put it together in a short video. So I hope their experience can inspire, and all of us could learn from it. So if it's okay, then we can start the recording. Hi, Laura. I think we might have to restart again with the audio.
Area, the patient unmet needs.
My name is Prudence.
Move Camp. Let's begin with the start of your journey with urticaria.
I've had urticaria for the past I guess 10-ish years or so.
Okay, appearance-wise, it's like very uncomfortable. You see, especially when you are on public, you take the public transport, and then the itchiness.
I started developing these like mosquito bites around my neck area, and I thought it would just disappear, but I just continued getting these small little dots everywhere on my body, and I realized that they would start to welt.
You're constantly feeling itchy, looking for a way to stop the itch. Most of the time, you won't be able to concentrate. You'll be just thinking about, so the itch is on my neck now. After this, when it will be coming, then you'll be constantly just scratching yourself over. And in a professional setting, it's quite unsightly.
Like an antihistamine every day to just calm the itchiness down was a little bit like stressful for me at first, because just the habit of taking it. But the itch was really quite bad, and even in school and stuff, I realized that I would always try and keep away from my classmates and everything, because I guess the way it looks is a little bit jarring to some. Just before I was even more aware of what I had and stuff, a lot of my peers would, I guess, they also are not very well knowledge in what urticaria is. So I would remember like a lot of people be like, "Ooh, what's that on you? Like you're covered in all of these like spots and red stuff." Like, yes, I am aware of that.
Like clothes-wise, you have to, sometimes you can't wear formal. You have to be, very, you have to wear thin, the material. Have to be soft, then you have to be baggy. It can stick. Try not to have the material sticks onto our body too tight.
A lot of different kinds of treatment. I've tried Western treatment. I've tried going to the TCM.
I've been on long-term Telfast medications. Then I think 2 years back, I took an injection for a 6-month course. He has been bringing down the hives, so it does not flare up so regularly.
This is started on omalizumab. Then I also have antihistamine and multileucas, mast cell blocker. That was when the condition started to be under control, I would say. A 50% reduction, and that is actually very good.
Maybe try not to be so anxious and paranoid about what other people are thinking about you. I guess it is just a journey that you have to go through to find out, I guess, a lot more about yourself.
Just believe in the medicine. It will work. Just time. Times it will feel extremely frustrating. You will feel that no matter what you're doing it's just pointless. But just keep on the treatment. There will come a turning point. It will slowly subside. To be very careful of the places that you go to, you would have to choose your clothes properly. Whether the place is going to be hot or cooling, try not to wear anything that is too suffocating or restricting. Those are terrible for the condition.
I think now it's a very normal thing. Everybody, I think out of all my friends, out of 10 friends, I think 5 of my friends has this issue. Just like do some exercise, make yourself occupied. Just try not to think about it now. You see, so sometimes I think our mood, you see, it also affected it. Sometimes when you are too stressed about it, and sometimes when you flare up, I will ask myself, I've been counting every day, when will it go off, when will it go off? Then it seems to be like worse. You see, so but if you try to cool down yourself, and mood wise you have to stay cool, and slowly we'll just go off now. 加油!
So I'd like to thank our 3 patients for very kindly sharing their personal story and also showcasing their challenges and the patient perspective, and also giving off their very kind advice that they would like to share with all our other patients as well. So we've wrapped up our webinar with the 3 talks from our doctors, and we shall now move on to answer the questions that all of you have kindly put into the Q&A session. So we shall start with the first question that was actually been posed quite a few times by different people actually on the Q&A forum. And I think everyone is very curious to know what is the difference between eczema and hives, or also what we call as urticaria. And for this, I'd like to invite Dr. Karen Chu to help us go into a bit more detail and show us really what is the main difference that we can look for.
Thank you, Laura. Because this has been asked 3-4 times, so I very quickly prepare some slides. Would it be okay if I share?
Wow, that's amazing. Thank you.
Okay, I hope you can see. Let me put it onto presenter view. Okay, so first of all, eczema and hives have quite a lot of similarity, and I can understand why sometimes both can be mixed up with each other because both are itchy. They can occur at any age, but predominantly, especially in eczema, in the childhood, and again, as we age. Both are common. Urticaria affects up to 10%, so does eczema. 1 in 10 of school children will have eczema in Singapore. This is a Singapore study. 1 in 5 adults, so it's quite common. And these are the same figures for urticaria. 1 in 5 adults at any point in your life may experience urticaria. And sadly, both can be triggered by stress and infection. So when you're feeling the worst, that's when the skin may betray you by feeling itchy with red rashes. So the first difference is that on examination, they look different. On eczema, you can see, I tried to Google pictures that to showcase that's very obvious. So you can see on the left, the skin is, it looks like a riverbed that haven't seen rain for a long time, that's been dry up. You can see cracks among the skin. And when you look a little bit closer, this red patches, they are scaly. When you scratch them, skin flakes fall off. You can see white color stuff that fall off. Whereas for urticaria, the skin looks like giant mosquito bites. It's smooth. And it may look awful and swollen, but there's no cracks. There is no scales when you scratch it. Unless, of course, you scratch until very bad until you draw blood. But if that doesn't happen in urticaria, you don't see fissures, you don't see weeping, and it's smooth. More importantly, however, eczema tends to happen over areas where sweat predominant. For example, over the elbow, the knee, the back of the thigh. This is where sweat tends to accumulate, and we know that sweat can trigger eczema or make eczema worse because it irritates the skin. Once it's active, it lasts for weeks, days and weeks, until you put moisturizer and topical steroids to repair it. And when it resolves, it leaves a pigmentation or a skin color difference, and there may even be a skin texture or scarring difference that occur. Whereas for urticaria, it can appear anywhere. I have a patient who tell me urticaria can appear on the scalp, all the way down to the sole of the foot. It can appear anywhere. Your face, your body, and it's spontaneous, random. You didn't apply anything there, and there it is on the tummy. But urticaria, they tend to last only a few hours, each individual lesion, I mean. So if you were to circle with your pen on an individual lesion, after a few hours or at least a day, it will disappear, but new lesion may appear elsewhere. And when it disappears, it leaves behind normal looking skin. There's usually no scarring, no pigmentation, and no bruising. But an urticaria is unpredictable. It can happen anywhere, anytime, in the morning or at night. But most of the time, a lot of my patients who share their symptoms with me, they complain that it's usually at night. And we know that it's because during the day, there's distraction to distract you from the itch. Whereas at night, you tend to feel the itch more significantly. So this is like a short 2 to 3 slides to answer what's the difference between eczema and urticaria. But if you think this is an important topic and you feel that we should address this in more detail, please leave your feedback because every year we'll be planning webinars and this is something that you want us to address. Definitely we can do this. I'm done. Thank you.
Thank you, Dr. Karen, for even taking the trouble to put up all the nice slides and summarizing the key differences between eczema and urticaria. So the second question that we have was mostly to Dr. Dawn, because I think some patients had some questions on the slide with the the slides that you went through, as well as how does urticaria impact one's quality of life. So I shall pass on the time to Dr. Dawn.
Hi everyone, thank you for your question. I will show my slide again. Okay, so this is the slide for urticaria. So urticaria is a medical term, but when we counsel our patients in clinic, we tend to use other terms. So these are some synonyms like hives in Mandarin Chinmarch and urticaria. This is in Malay, and then do aripu, it's Tamil. And then for the impact of urticaria, this is a very, very common question. So because it's so common, right? 1 in 5, or many of our Singaporeans are suffering from this condition. This study that was actually published quite some time ago say that a lot of Singaporeans are actually affected by urticaria in a way that the sleep is affected. They feel immense itch, so that it's affecting their work, their social interactions. And because they have such poor sleep, they wake up feeling tired. And then this everything interferes with their daily activity. So, but the good thing is through our treatment and management in our clinic, we do see a lot of our patients benefiting from the measures that we have introduced. And with that, when the itch is better, the skin is better, they feel that they can sleep well and they can function better. And thereby, this will improve their quality of life. Yeah. Thank you.
Thank you, Dr. Dawn. So as our very own 3 patients have demonstrated in their video, there is definitely a significant impact on the quality of life to our patients, which we definitely aim to improve whenever we see our patients in clinic. So our next question would be to Dr. Chai. If I could move on to the next, yeah. So this has been asked a couple of times in our chat as well. So quite a few people have asked about the side effects of antihistamines with regards to whether it's safe to take for daily for a long period of time, and whether also if someone can develop a tolerance to it. And they also ask regarding side effects if they can cause brain fog, which is the exact term that someone typed into the group chat. So we will let Dr. Chai address this. Thank you.
Yeah. Thank you for the question. So side effect antihistamine, we would say generally the newer generation, that refers to the non-sedating one, those that won't cause you to be sleepy, they're generally safe. And also why I would advise to avoid the ones that cause you to be sleepy, or help you to sleep better, is because this ones, if you take in the long term, there are the side effects, that I mentioned earlier. Not just in the short term. Although it helps you sleep, you might actually be getting poor sleep. You're not sleeping well, although you thought you're sleeping, right? And you get all the dryness, all the urinary problem in more elderly patients. But the newer ones, generally, they're quite safe. But in terms of whether you can develop tolerance, I mean, there are no proof to, so far, there's no strong evidence to say, you might develop tolerance or cause you long-term harm. But sometimes what happens is you might find that at some point it doesn't work so much as well for you anymore, then we can actually switch to the other type of antihistamine. Whether it can be safely taken for a long time, in general, although it's quite safe to be used, the non-sedating ones, once we identify that your disease, your urticaria is well controlled, we do want to reduce the amount of medication to be taken. But it's more of a balance. If you compare, because if you don't control the problem, you will have these hives, and it will affect, in general, a lot of your work function, your sleep, your quality of life, and it might go on for a long time. As we know, chronic hives actually on average, it can go on for 5 to 7 years. And can you imagine if you have this for 5 to 7 years, and it affects you so much? I think there are a lot more health risks that comes up with it. So I think the benefit of it to control it, using the non-sedating one, is generally safe. Yes.
And then for Dr. Chai again as well. So the difference between antihistamines and steroids. So I guess to a large proportion of our audience, they might not be familiar with the real difference in terms of whether it's an oral form, cream form, or maybe Dr. Chai can address this. Thank you. Yeah, I'm not sure if. Okay, so for the main difference between antihistamine and steroids, they are a big difference actually, in terms of the class of medication itself. And as Dr. Karen has mentioned earlier, we do not typically use steroids for the treatment of urticaria, while we use that for the treatment of eczema. And antihistamines, as we have emphasized throughout this talk, really plays a big role in the treatment of urticaria as well. Okay.
Hi, Laura. I can take the question about brain fog.
Mm.
So there are two main groups of antihistamine. One that is sedating and one that is non-sedating. What's the difference between the two? The sedating one can make you feel drowsy, sleepy, and brain fog. Examples are Piriton or the drug name chlorpheniramine, Atarax, or the drug name hydroxyzine. Those are the two most common sedating antihistamines that are typically given. We now prefer non-sedating antihistamines because of the side effect profile. It shouldn't cause any drowsiness or brain fog or tiredness. And there are many different non-sedating antihistamines out there. For example, loratadine, levocetirizine, fexofenadine or Telfast, the brand name. Bilastine has been asked a few times on the Q&A section, so that's a non-sedating antihistamine. Rupatadine. So there are many types of antihistamines. The next question typically one will ask me is, how do you know which one is best for you? We will try to match it according to your symptoms and the symptom severity. So the dose will be depending on the symptom severity. And they are not medicines meant to be taken forever and ever. Having said that, they are safe medication. Once you stop it, usually these antihistamines are out of your system within 24-48 hours. They are not medicine that lasts in your body for a long time. So in general, they are quite safe. However, we would advise that if you need long-term antihistamines, come and see a doctor, check that the indication is correct, check that the dose is correct, and that the way you're taking it is effective for you. Over to you, Laura.
Thank you, Dr. Karen. So yes, so like what Dr. Karen has mentioned with regards to Bilastine, it is actually a safe antihistamine to take as well, and we do prescribe it quite regularly in our clinic. So I think we've managed to answer a total of more than close to 50 questions from all our patients and audience. And I'd like to thank everyone for taking your precious lunchtime to join us this afternoon. So if I could ask the liaison service to maybe flash the slide on the QR codes as well, because we would like to get everyone involved to fill in the feedback as well as some questions, and this will help us understanding more about the treatment available and what you'd be interested in terms of the treatment for urticaria as well. And I note that someone also asked about how to get an appointment with us. So there is a QR code that will be flashed as well, that if you'd like to get any sort of appointment slots as such. Okay. So I'd like to give a big thank you to Dr. Karen, to Dr. Dawn, as well as Dr. Chai, for going through very comprehensively and sharing their insights into the treatment as well as how urticaria presents. Thank you everyone for joining us. Bye. Sorry, did we miss one last question? Is it possible to outgrow hives? Okay. Are
I
you
can
still up
take
to
that.
answer
I
this
can take that.
question, Karen?
Okay. Short answer, yes. Hives can disappear. Do not lose hope. You might need medication though. Long answer, please come and consult because there may be other reasons that we will need to consider, and we would like to match your medication to you, personalized care. So yes, hives can be cured.
Okay, promise, the last one. Please fill this out. Thank you. Bye-bye.